Our vision is for an Africa where anyone can get help in 10 minutes or less. And for us, that is literally anywhere. We're talking about even the person kind of far off in some community somewhere. Folake, yes.
Why do you do what you do?
At the heart of it, I believe that everybody should have access to healthcare. Definitely, I think it's a fundamental human right. But in the context of what I do specifically, emergency healthcare, I think it's even more of a right because any one of us can have an emergency at any time. There's no predicting. Even if you are the wealthiest person, you have no idea when or where it could happen. And so being able to guarantee that people can have access to care, like regardless of who they are and what the circumstances are, I think it's important. Yeah.
Definitely important. And could you walk us through how you actually started your business?
Yeah, sure. So, I always start with the story. It came from a place of personal experience. My son had an emergency in 2017. He was like a year and a half old at the time, woke up, in the middle of the night screaming, obviously in some kind of pain, but I couldn't figure out what was wrong. But because we were in Canada at the time, I called 911. And, 911 was something you grew up knowing about because you watched movies with 911 in them. And so, yeah, we called 911 and two paramedics came, they treated him and, it turned out to be minor. And they said, you really don't need to go to hospital. And I think, that experience opened my eyes to the fact that if the same situation had happened in Nigeria, which is where I'm from and where I was born and raised, it would have been a very different experience, probably I would have woken up our neighbor and asked them to drive us to the nearest hospital. The hospital that was close to where we lived had a very bad reputation as a death trap. So if you go in alive, you don't come out alive. So there was already that mindset of even if I make it to the hospital, like how do I know he's going to get the right care? So those were some of the concerns that were swimming around in my mind. And my background is in public health. So that experience sparked me to start to research and try to understand how do we solve problems when we have emergencies. And I realized we don't have a good solution. We just, figure it out or, go through the process I just described. And the unfortunate part is there's so many deaths as a result. And so I saw what I thought was an opportunity to solve the problem. My co-founder and I met as graduate students at University of Waterloo in Ontario in Canada. And this is a business entrepreneurship and technology master's program. And it's all about how do you take something from like an innovative idea into a viable venture. And yeah, through that, we started talking about this problem. She shared how she had actually lost a family member in Ghana because they couldn't get an ambulance on time. And so, for us, I think that opened our eyes to the fact that this isn't just like a Nigerian issue. This is very much a Pan-African problem. It's a developing market problem. And if we can come up with a solution, it's something that could certainly scale right across those geographies. She has a tech background. I'm, public health, and so we started ideating on what that might look like, and landed on what Emergency Response Africa is today. Which is solving that problem.
And that idea, what were the steps that you actually took to turn it into that business?
Yeah. So definitely, like the first was research. And I don't know, maybe different people take different paths, but I think that research was really important for us because it gave us a really deep understanding of what the issues are and how complex and multifaceted the problem was. It's one of those things that they describe as a wicked problem, right? So many issues, feeding up into one, so many ways that so many things that need to exist in order for the problem to be solved. So that research was step one. But the moment that we had enough information, both from just like, regular searching online and looking at, past articles or journals, but also talking to people, right? So talking to some people that were in the healthcare space. I remember speaking to one of the pioneers of emergency care, urgent emergency care. She started up the first air ambulance company in Nigeria, or maybe even in West Africa. And, she's one of our investors today, but I remember having an early conversation with her and just trying to understand how she went about it, right? So all of that research was very helpful. The next step was then just, well, what are the possible solutions? We had an idea of what we thought we wanted to do. My first idea was I wanted everybody to be able to turn their cars into ambulances to like be able to pick people up. So that was like the original idea. But as time goes on, the more you research, the more you realize maybe that's not going to work quite so
An
well.
Uber for ambulances.
Yeah, exactly, right. But then we started to like shift that and landed on the model that we have today, which has also evolved, but it's more of a community-based first responder model. We have medics in the community that are on motorcycles and can get to the scene quickly and provide some treatment at the scene. But then we also have ambulances that are owned by hospitals or private ambulance parties that we've onboarded onto our platform. So it's almost like a hybrid kind of model. And what it means is if you reach out to us, we operate a 24/7 center. If you reach out to us, we're going to connect you with the closest available response team based on what is actually happening to you, right? Based on the severity of your case. So, coming up with that solution, the next step was, okay, how do we test it? That part, initially wasn't so clear to us. So because of the program we were in, we had the opportunity to join some pitch competitions, and that ended up being really valuable. I've talked to a lot of people who are very hesitant about sharing their ideas, fairly early on because they feel like, well, it's not perfect, yeah, or someone's gonna steal it or whatever. And I think the benefit that we got from sharing early on was that we got lots of feedback. Not all of it was useful, some of it was just stuff that we had to be like, all right, thank you for that, and set it aside. But it was helpful because it showed us that there was something there, and that maybe with some tweaks, with some modifications, maybe we could get to a real tangible solution. But the other thing that those pitch competitions did was it gave us a little bit of seed capital, because we won some of those competitions. These were grants that weren't necessarily loans we didn't need to pay back, and so that gave us the ability to then sort of create our first prototype for the technology. And so we went to Nigeria in February of 2020 and did a pilot. And that pilot was very short, very controlled. We pulled together a pool of people as like first responders, took them through training and then dispatched them to simulated emergency cases. Obviously, we can't use real people, for testing purposes. And what that did for us is it taught us a lot about who needed to be a responder. It also taught us a lot about the challenges we would face when it came to like technology adoption and actually being able to dispatch effectively. And then COVID hit, right? So for the next really about 10, 11 months, we didn't really get to do much. We continued to like develop the technology a little bit because now we had some real world feedback. But we then started trying to raise like a small kind of, I guess, pre-seed, if you will, or friends and family and whoever else would come on board. And things were very slow for a while. And then we got a grant from the Japanese government. So the Japan International Cooperation Agency, so their development arm, they gave us like an innovation grant as part of their COVID-19 support to African businesses. And that grant allowed us to then secure some matching funding from local investors. And so local investors in Nigeria, a group of wonderful women angels called Rising Tide Africa, and then some investors in Canada as well. So we kind of scrapped together a very small pool of funding to launch the business, which we did in 2021. And so we started with a small team. I think there were like 7 of us in total. We had, one person, manning our phone line. We had, one developer, working with my co-founder. It was interesting. I'll say that, and it's been, developing and growing since then. But that's been the process.
And could you walk us through your service offerings of what emergency response actually does?
Yeah, for sure. So what we do is we make sure that if someone's having an emergency, they get the help they need as quickly as possible. And the way that works is we've built the largest network of first responders, ambulances, and what we call emergency ready hospitals. So these are hospitals that we've taken the time to actually visit and verify that they have some of the basic requirements for a facility to respond to some of the most common emergencies that come up. And so essentially the way it works is someone can reach out to us either via a toll-free number, which we operate 24/7, or through our mobile app. We also have APIs now that we provide through other applications in some of our corporate partners. But yeah, they can submit a request or they can reach out to us and say, hey, I need help. We take them through a triage process. So we want to understand like what is the nature of that emergency, and then we dispatch. So our medical dispatcher will use the platform to send off, one of the motorcycle medics or an ambulance, to pick up the patient. Now, essentially, that is our core service offering, emergency response services, and we offer it to people. Ideally, we want to offer it before you need it, because when you have an emergency, that's the worst time to be looking for who do I call, what do I do. So we do offer subscription plans. We work with corporate organizations, to protect their staff or to protect their members. And most recently, we started working with government as well, which is something that we're very excited about. We do also offer training. So first aid and basic life support training and certification, both for like laypersons as well as healthcare professionals. And it makes sense for the nature of our business. The more people are educated about first aid, the better for everyone, including us as a professional emergency response provider. So those are kind of our core offerings.
In terms of the subscription model, have you had any challenges with people not being able to afford that?
Oh yeah, 100%. And that's a big part of why, I mentioned the government angle. As we know, right, like there is a lot of poverty in the land, and people, the money that people have, they need to spend it on food and shelter and like their most basic needs. And yes, I would argue that healthcare and access to emergency healthcare is a most basic need, but it's not something that happens every day. So, for a person who is, literally living hand to mouth, it is difficult to say I'm going to pay for this thing that I may not use, for a long period. And so for those people, it is very difficult. What we've tried to do to address that is get into partnerships with government. So we have a partnership with a state government that's kicking off really soon, which we're excited about because it's in collaboration with a development finance institution. And the whole objective is how do we use emergency services to support the fight against poverty? And if you think about it, there is a strong connection. God forbid a family loses the primary breadwinner in a sudden emergency situation. Not only have they lost someone that they love, they've potentially faced like, medical bills as a result of that, but then you have literally the ongoing outcome or the ongoing result of the person's just not earning enough to take care of the family anymore. Whereas, or well, they're not earning, period, because they're no longer here. Whereas if emergency services had been available, they might have actually been saved, and that family wouldn't necessarily have gone into abject poverty, right? So there's a strong connection between access to emergency services and people's socioeconomic health. And so this project essentially makes it possible for anyone within the pilot area within that state to be able to access the service without having to pay for it. And for us, that's like ideal, right? Because again, we want emergency services to be available to everybody. It's literally one of our values. It says for everyone. So yeah.
And in terms of the medical aid part, so if that person does happen to pay for your subscription and they have an emergency, the ambulance comes and the ambulance happens to be from a private hospital, So how would that person then cover the medical bills, or will they be transferred?
Yes. So there are a couple of ways around that. Generally, the patient is responsible for their medical bills. Again, going back to this conversation about payment and affordability, in truth, what I think is like 70% of all healthcare expenses right now are out of pocket, right? So that's a challenge on its own. One of the things we offer along with our subscription is the opportunity for people to actually purchase insurance. So if you don't have an existing health insurance plan, why buy only an emergency plan when you can buy something that combines emergency and insurance? That way, if we have to take you to the hospital, a portion or all of your medical bills are actually covered by that insurance plan. But if a person does not have any sort of existing insurance, then yes, they would be responsible for paying their bills. And so to that end, we make sure that we're taking people to a hospital that makes sense for them. So we don't necessarily pick a person up and insist you must go to this specific hospital because we have a partnership with them. No. What we do is we are able to present them with a few options based on their situation and based on our knowledge of these different hospital partners. Or if they already have their own hospital, which, for people maybe with like chronic conditions, they already have a place that they have a relationship with, that they treat themselves already, we'll take them there.
And was it challenging to actually go and approach these private hospitals to partner with these emergency services? Was there any challenges there?
Yeah, it wasn't easy, and I think especially the bigger ones, right? Like it's at the end of the day, though, I think what helps is understanding what's important to them. At the end of the day, a private hospital wants footfall. They want the right footfall. They want the right set of people that are coming in that will use their services and pay for their services, whether that be directly or through insurance. Sometimes they don't like insurance. And so for us, it's making sure that if we are bringing a patient to them, we're bringing a patient that has demonstrated that they have the capacity to pay. And so getting into the partnerships themselves is not as difficult as making sure that on an ongoing basis it's valuable for both partners. It's not easy, but it's doable, and we just try to keep the lines of communication open. Sometimes, for example, going back to our training offering, we'll offer some of our hospital partners access to our training center for some of their staff, and it's a simple way of giving to them or empowering them, but it also benefits us because if their staff are well equipped to handle the emergencies that we bring in, everybody wins, right? So it's little things like that that help to keep the relationship.
And scaling across to other African countries, what's your challenge when it comes to taking this kind of ecosystem to another African country?
So we haven't done it yet. Right now we're just in Nigeria, but we have done it within Nigeria. So right now we operate in 5 different cities. And it's really about being able to establish and maintain effective partnerships, because our model isn't to buy a bunch of ambulances and buy a building and put them all there and then try to operate. It's about how do we better utilize the existing emergency response resources, and have technology kind of be at the core of that. And so I anticipate that one of the biggest challenges going into any new African country will be how do we identify the right kind of partners that will kick off this market, both from the supply side and the demand side, right? So who are the hospitals, who are the ambulance owners that we can partner with? Do we set up our command center locally so that there's a local number? Can we plug into the government's emergency number if they have one? And then, of course, on the demand side, what are the companies that are in those high risk industries that would want to protect their staff? And can we, secure some of those contracts early on so that the business is viable, financially as quickly as possible? So it's not something we've done, but it is something that we want to do and have certainly given some thought to. And we're actively, thinking about how, a year or two from now we can start to make those expansion moves.
And in terms of onboarding customers, has there been any challenge to sell them, oh, this is
Oh,
a
yeah.
solution that you need?
Oh yeah, absolutely. And I think it's a combination of multiple things. It is an environment where people have not had access to that forever, right? And so you're bringing something that while it isn't entirely new, it is new for the context, right? I was just telling someone how, if you look at a list of our testimonials, if I give you like 10 testimonials right now, the common theme that you would see is this whole idea of, I didn't know who to call. And so I saw this number and I really wasn't sure because I didn't know what to expect, or I didn't think they would answer. I didn't think they would come, but I'm so glad I called because blah, 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 blah. It's always the same pattern. And for us, it tells us that, people need a solution, but they don't believe that there is one, or even if someone is there and claims to be a solution, they don't really believe that it's going to work. And that's come from just years and years of failed promises, right? Maybe a politician will buy 30 ambulances and donate it to some communities, and but it's nothing more than a political gesture. And what it means is, if you go and look 2 years down the line, those ambulances are all sitting there, or they're using it to take plantain to the market or something, right? Like that's the reality. Like, this is a real example. I'm not making this up, right? So yeah, I think, it's not easy to sell people on something that they've had such a different mindset to. And then the other thing is, we already struggle with purchasing insurance. If you look at Nigeria, because there isn't any, like, as of right now anyway, legislation that mandates the purchase of that health insurance. And so right now, the best number you'll get for insurance penetration is 10%. And so a lot of great companies are now pushing that insurance narrative and getting more people into the insurance net. But you can imagine that if people aren't purchasing health insurance, which is the whole package, they're not likely to think about purchasing an emergency plan, which technically is like a subset of that. And so I think for us, part of that is, okay, let's partner with health insurance, but also let's partner with other corporate organizations. Are there innovative partnerships that maybe aren't like typical, you wouldn't necessarily think of it, but actually make a lot of sense to have emergency services as part of? And that's where the API comes in. So now we have some partners where, in their mobile app, they can push a button, and the clients can push an emergency button and it comes to us. And that's one of the like distribution channels that we're really exploring now.
What would you say is your big, hairy, audacious goal for your emergency response?
I would say it's our vision. Our vision is for an Africa where anyone can get help in 10 minutes or less. And for us, that is literally anywhere, right? We're not talking necessarily like, Addis Ababa or Lagos or Abuja or Johannesburg. We're talking about even the person kind of far off in some community somewhere. And so for us to achieve that, we know that we're going to need multiple different models that make sense to the very local environment. And we're going to need funding that is both patient and flexible. We're going to need partners that see the big vision and believe in it and understand the implications of achieving that vision for other health outcomes. If you think about the challenges we have with maternal mortality, on this continent and in most of these countries, emergency response has a huge role to play in reducing deaths from obstetric emergencies, from infant, or child-related emergencies. But again, it's not something we actively think of. But I believe research shows it's one of those solutions that if you implement, you can cut down the number of deaths in lower middle income countries by as much as 54%. So this isn't like if there ever was a silver bullet, this is probably as close as it comes, in the same way that we talk about like vaccination and all of that. But again, it doesn't get as much attention as it deserves. So.
Thank you, Folake. I hope
Yeah.
that, firstly, I want to acknowledge you for making this impact.
Thank
You
you.
could have stayed in Canada, but you chose to come
I
back.
could have.
I mean, you're making this impact in Nigeria and other African countries in the future. So thank you for doing that. And
Thank you.
Shortly, we're all going to be seeing that every person in Africa has that access to an emergency response.
Amen.
So, yeah, so I just want to acknowledge you for doing that and the mission that you're on. And I hope that you
Yeah.
do find those partners and sponsors and investors and people that are aligned with your vision. So thank you.
Yeah, thank you so much. And thank you for having me. You're doing a great job. These stories need to be told. So thank you.
Cool. Thank you.
All right.